Okay, so this is not a 10-minute topic. I'm going to do my best to highlight a few key areas, namely infection control in small animal clinics, what can we do to prevent infections in the first place, reducing the use of systemic antimicrobials in a few common situations, and because this is such a short presentation, I've provided a list of what I think are helpful resources for people to refer to for more information. So, most small animal veterinary practices do not have a written infection control program. A 2010 survey of 101 companion animal practices in southwestern Ontario indicated that 0 out of the 101 had written protocols. Now, this statement from the 2018 American Animal Hospital Association Infection Control, Prevention, and Biosecurity Guidelines succinctly says why this is so important. Without effective infection control, prevention, and biosecurity implemented in the veterinary primary care and referral settings, the clinician's efforts at disease prevention and treatment are compromised and in some cases nullified. So the proposed PIPS bylaws, which we will be discussing at the PIPS party, state each VPE must have a written infection control program accessible to all staff. And most of us don't have one, which means that we will need to create one for our clinics. And before we start all our moaning and groaning, I will ask the following question to you all. Would you visit a human hospital that didn't have a written infection control program, and why should or would we be different? Writing it down will force us to think about what we are doing, improve on what we are doing, and help us train our staff. As we are all aware, we all have staff in our clinic that didn't receive any formal education on infection control and disease transmission. So there are a number of published studies out there indicating that we have a lot of room for improvement in the small animal setting. These are the types of studies where they culture alarming bacteria from common surfaces such as tables, kennels, runs, keyboards, stethoscopes, otoscope tips, and thermometers. There are several of them, and we don't have time to discuss them, but I'll cite one quick example. This was a study where they looked at clipper blades from 60 different practices. It was from 2016, and 51% of the clipper blades sampled were contaminated with bacteria, and it was like staph and E. coli and things like that. So they concluded that clipper blades should be considered potential fomites. So if I have you convinced on the why, where do we best focus our energy in the small animal setting? So first on the list is fairly obvious. Start with hand hygiene. Hand hygiene is the single most important way to prevent infection in the healthcare setting. I was recently at a human ER, and I swear you couldn't walk 10 feet without running into a hand sanitizer dispenser. And then right when I walked into the ER, there was a large sign that said 94.5% hand hygiene compliance, which to me meant that they were auditing this. We all know this is important. We all know the best way to treat infection is to prevent it in the first place. So I will ask, how many receptionists put hand sanitizer on between every patient they greet in the waiting room? So next on the list would be barrier protection. We are probably all good at barrier protection for really contagious things that we put in the isolation rooms such as parvo. But when it comes to more routine things, we're veterinarians. We don't get grossed out easily. We are all guilty of touching things that we shouldn't touch with our bare hands. Even when we are smart enough to put on gloves. How many of us wash or disinfect our hands after we take those gloves off? How many of us think to instruct our staff to wear gloves when they're doing laundry in the clinic? I mean, pretty much all of our laundry is contaminated with some sort of bodily fluid. So next on the list would be choosing an appropriate disinfectant and then using the product as directed. So with regards to choosing a disinfectant, I personally want something that is easy, so it doesn't require a complicated dilution, works quickly, has some effectiveness in the presence of organic debris, gets all of the common pathogens we can see in a small animal practice, and is not toxic to me and to the people I work with. So at this point in time, I personally am using the accelerated hydrogen peroxide products because they tick most of those boxes. When I first graduated, I was used to using quaternary ammonium compounds in the clinic, and I don't think we ever used them according to the product label. I mean, how many of us sprayed the table and then waited 10 minutes before we wiped the table dry and saw our next patient? I mean, we just don't have time. So finally, for clinics that hospitalize patients, it is highly recommended that patients are not fed their raw diets while in the clinic. Whether you love or you hate raw diets, it has been published that feeding a raw diet is a significant risk factor for carriage of antimicrobial-resistant Salmonella species and E. coli in dogs, even dogs that have never visited a vet clinic. So I'm going to leave my raw comments there, as we definitely don't have time to open that can of worms in a 10-minute talk. Okay, so the next topic I'll touch on is reducing the use of systemic antimicrobials in some common situations. So first would be superficial canine pyoderma. Not all cases need to be treated with systemic antimicrobials. So allergies and otitis externa are the top two reasons why dogs come to see their vet in North America. Many of these dogs end up on systemic antibiotics repeatedly to treat the secondary infections associated with their allergies. So in the last several years, we have so many more tools in our toolbox to manage their atopic dermatitis better. Apoquel, Cytopoint, Atopica. If we manage their allergies better, they get less infections. We also have a lot more tools in our toolbox to manage it topically. There's good evidence that shampooing with chlorhexidine has residual activity for up to 7 days. I've personally seen many dogs with pyoderma treated with twice-weekly baths with 3% chlorhexidine shampoo. The other comment, and this is a little bit soapbox, I would make as someone who does a lot of dermatology referral work is to stress the importance of cytology. Many of the dogs I see for dermatology consultations have Malassezia infections. For the non-small animal types, that's yeast. So this is missed without cytology. Many of the dogs have been on a gazillion antibiotics without any cytology or cultures performed. And I know cultures are not always possible due to cost, but cytology is cheap, and dogs with Malassezia don't need antibiotics, they need antifungals. So another common area in companion animal medicine where we use a lot of antibiotics is dentistry. And we know that periodontal disease affects more than 70% of our population. So it's no longer recommended to put pets on antibiotics routinely before or after a dental cleaning or dental extractions. And this is a huge paradigm shift. I will fully admit it was super scary the first few cases where I performed multiple extractions and didn't send them home with antibiotics. But the good news is they heal just as well. But we can't fall back on, if we're not going to use antibiotics, we still have to do a good job treating their dental disease. We have to, extract the teeth properly, flush and curette those sockets, and make good gingival flaps. And we have to follow up with our patients. So next on the list is another area where clients try to pressure us into prescribing antibiotics. And that's what they're now calling kennel cough, canine infectious respiratory disease complex. I don't know why they had to change that. But in a survey study, a survey study published by Dr. Joffe in the CVJ in 2016, 89% of those kennel cough Canadian cases were viral. So not much of an argument there for antibiotics. And I'll just finally briefly touch on diarrhea. I am just as guilty as everyone for putting them on metronidazole. Why not? It works. Clients do not like waking up in the middle of the night cleaning up diarrhea. The reason I think we have to rethink our approach is that metronidazole is a Category 1 drug. So these antimicrobials are considered of very high importance in human medicine as they meet the criteria of being essential for the treatment of serious bacterial infections and limited or no availability of alternative antimicrobials for effective treatment in cases of emergence of resistance to these agents. So what can we do instead? There seems to be a lot of work right now going on in the world of probiotics. I'll mention one that I heard about recently that shows some promise. There's a new product called Hygiene. It's a combination of a probiotic and a proteobiotic that has been shown in placebo-controlled studies in swine to decrease incidence of and aid in the treatment of diarrhea. And it is my understanding that there's a large study of dogs submitted for publication. And in that study, 72% of acute diarrhea cases and 82% of chronic diarrhea cases, their diarrhea resolved. So it is my understanding that there's some controlled studies underway as well. And then with chronic diarrhea, many practitioners in the human and veterinary fields are now doing more fecal transplants as an alternative to antibiotics. Okay, so I'll just mention a few resources. Earlier I mentioned the 2018 AHA Infection Control, Prevention, and Biosecurity Guidelines. I swear it's an easy-to-read document. It can be found just by Googling it. And then the Canadian Committee on Antibiotic Resistance authored a 71-page document on infection prevention and control best practices for small animal clinics. The good news is they summarized it into an easy 5-page document, and that can also easily be found with a Google search. With regards to prudent use of antimicrobials, the CVMA has their prudent use guidelines, and they're very good. You need your password, and they're a little bit tricky to find on the CVMA website. They're under practice and economics, not science and knowledge. I thought that was a bit weird. And then just finally, 2 other ones. The International Society for Companion Animal Infectious Disease website. There are links there to open source documents about infection control as well as prudent use antibiotics. And then in terms of client handouts, which is always great to have, Dr. Scott Weiss at the University of Guelph has his wonderful blog, Worms and Germs, and there's some really useful articles for pet owners there. And I know we're not allowed to ask questions now, right? Hopefully I was close to 10 minutes.